Hey everyone, and welcome back. Today we're tackling a listener request, taking a deep dive into healthcare access in the Philippines.
Excellent.
Specifically, you want to understand those expanded benefits
Yeah.
for persons with disabilities.
Right.
That came about with Republic Act 10754.
Yeah.
And of course, the guidelines are all laid out in Administrative Order 2017-0008.
Perfect.
Yeah. It might seem like we're getting into the weeds of regulations here, but really, this is about something much bigger.
Absolutely.
It's about making sure that people get the medical care that they need.
It is. And it's fascinating how this order really puts the Philippine Health Agenda's goal of inclusivity into action.
Yeah.
It builds on that existing Magna Carta for persons with disabilities, but takes things a step further in terms of specific healthcare support.
Okay, so RA 10754 kind of sets the stage.
Yeah,
And then this administrative order gets into the nitty-gritty.
that's right.
But before we get lost in the details, I think it's important to clarify who exactly benefits from all of this.
Well, the guidelines define a person with disability, or PWD, more broadly than you might think. Annex A actually lists out 21 different types of disabilities.
Wow.
It covers everything from physical impairments like visual and hearing problems to psychosocial disabilities, learning disabilities, and even chronic illnesses.
Oh, wow.
It's a real recognition that disability isn't one size fits all.
That's a really important point, right?
It is.
It's about acknowledging that diversity within the PWD community.
Yes.
And making sure that the system is inclusive.
Exactly.
And it's not just for adults, right? Children with disabilities are covered too.
Absolutely. The definition encompasses individuals of all ages, recognizing that children with disabilities have unique healthcare needs as well.
All right, so we've got a clear picture of who this applies to. Now let's talk about the actual benefits.
Okay.
Because I'm seeing this 20% discount and this VAT exemption, and that sounds pretty impactful. Where exactly do those apply?
Well, this is where it gets really interesting. The 20% discount covers a wide range of essential healthcare goods and services. We're talking medicines, both generic and branded, medical devices, and equipment.
Okay.
Think wheelchairs, hearing aids, crutches, even specialized dietary needs.
Wow. So it's not just limited to pharmaceuticals.
No.
It covers a whole spectrum of needs.
Yeah.
What about professional fees and actual medical services?
Those are covered too. You get the discount on professional fees from doctors, dentists, and rehabilitation specialists, as well as on the cost of hospital care,
Wow.
both inpatient and outpatient. And that includes things like lab tests and other diagnostic procedures.
So it's pretty comprehensive. Basically, almost anything you can think of that's related to medical care
Yeah.
is included in that 20% discount. That's a significant saving.
It is.
But what about this VAT exemption?
Okay.
Is that on top of the discount, or is it something completely different?
It's a separate benefit, but it works in conjunction with the discount to maximize savings. Imagine this, you're buying medicine, and first they knock off 20% because you're a PWD.
Okay.
Then on that already reduced price, they take off another 12% because of the VAT exemption. It's like a double whammy of good news for your wallet.
Okay, so the VAT exemption basically means you're not paying the usual 12% value-added tax that's applied to most goods and services in the Philippines.
You're right.
And that applies to all the same things as the discount, right?
Right. It's designed to make healthcare more affordable for PWDs across the board. And remember, these benefits can really add up, especially for ongoing medical needs or expensive treatments.
Yeah, definitely.
Yeah.
This is definitely a lot to take in. But it's amazing to see how much thought has gone into creating this support system. It's clearly about easing that financial burden on PWDs and their families when it comes to healthcare. But let's get down to brass tacks. If I'm a PWD and need to access these benefits, how does it work in practice?
Okay.
Do I just flash my PWD ID card and get the discount?
Well, the PWD ID card is definitely the first step. You need to have a valid card issued by your local government unit or LGU. Think of it as your golden ticket to accessing these benefits.
Okay, so PWD ID is key. But what if I need to buy medication or a medical device?
Okay.
Is it as simple as showing my card at the pharmacy or medical supply store?
It's pretty straightforward, but there are a couple of important things to keep in mind. First, for most medicines and devices, you'll need a prescription from your doctor.
Okay.
And it can't be just any old prescription. The administrative order gets pretty specific about what needs to be on there.
Okay, this is where it starts to sound a bit complicated. What kind of details are we talking about?
All right.
Is it more than the usual name, dosage, date kind of stuff?
It's all about ensuring everything is properly documented and accounted for. The prescription has to include your name, age, address, the specific generic name of the medicine, the dosage form, how strong it is, how much is being prescribed, and of course your doctor's signature and license number. They even require the doctor's professional tax receipt number and their narcotic license number if the medication falls under that category.
Wow, they're really dotting their I's and crossing their T's.
Yes?
I guess it's about preventing any misuse of the system and making sure everything is legitimate.
Precisely. It's about protecting both the PWDs and the healthcare providers.
Right, so PWD ID, detailed prescription check and check. Anything else I need to know about accessing the discount and VAT exemption?
There's one more crucial piece of the puzzle, the purchase booklet.
Ah, yes, the purchase booklet. We touched on this earlier, but I have to admit I'm still a bit fuzzy on what it's all about. Is it like a coupon book or something?
Not quite. It's more like a personalized logbook for all your purchases that are related to the PWD benefits. And it's not just any old notebook. It's officially issued by your local social welfare or health office free of charge for PWDs.
Okay, so it's a regulated document.
Mm-hmm.
What kind of information goes in there?
Every time you buy a medicine or a medical device using your PWD benefits, the details of that transaction get recorded in the booklet.
Okay.
We're talking the name of the medicine, the quantity, the date, even the attending physician's name and license number, and the details of the pharmacy or medical supply store.
That sounds pretty comprehensive.
Yeah.
But what's the point of all this record keeping? Is it just for the PWD's personal reference, or does it serve a larger purpose?
It's primarily about transparency and accountability.
Okay.
The booklet provides a clear record of how the benefits are being utilized, which helps prevent any misuse or fraud.
What?
It also protects both the PWD and the establishment in case there are any discrepancies or disputes down the line.
So it's like a safety net for everyone involved. It makes sense that they'd want to keep track of everything so meticulously. But what about those situations where a PWD might not be able to handle the purchase themselves? Let's say they're a child, or they have a condition that makes it difficult to manage all these details. Does that mean they can't access the benefits?
Not at all. The administrative order has provisions for that as well. If the PWD is a minor or is unable to manage their own affairs, a parent, legal guardian, or a designated representative can step in and make the purchase on their behalf.
Oh, so it's not like the system excludes them just because they need a little extra support. That's reassuring to hear.
Exactly. It's all about making sure everyone who's eligible can access these important benefits. The representative just needs to present their own valid ID and proof of their relationship to the PWD.
And I'm guessing all of that gets meticulously recorded in the purchase booklet as well.
You bet. Transparency is key. Now, remember how we talked about the interplay between the PWD benefits and PhilHealth?
Right, you mentioned it's like a double layer of protection, but honestly, I need a bit of a refresher on what PhilHealth is exactly. It's the national health insurance program here in the Philippines, right?
Exactly. It's a government-run program that aims to provide financial protection against the cost of illness and hospitalization. And the administrative order really encourages PWDs to become PhilHealth members.
So if you're a PWD and you're also a PhilHealth member, do you get to stack the benefits, like 20% off for being a PWD, then another chunk off because of your PhilHealth coverage?
Unfortunately, it's not quite that simple. You can't actually double dip on the discounts.
Okay.
But here's the good news. If you're a senior citizen as well as a PWD, you can choose whichever discount is higher, the senior citizen discount or the PWD discount. So you're always getting the best possible deal.
Okay, so it's not about piling discounts on top of each other. It's about making sure you're getting the maximum benefit you're entitled to. That makes sense. It's like built-in flexibility for different situations.
Precisely. Now let's circle back to that VAT exemption for a moment. We talked about how it works in theory, but can you give me a real-world example of how that plays out? Say I'm at the pharmacy buying medicine.
Okay, let's say your prescription costs 1,000 pesos.
Yeah.
Normally, you'd have to pay an extra 12% on top of that for the value-added tax, which would be another 120 pesos.
Right.
So your total bill would be 1,120 pesos. Ouch.
Exactly. But because you're a PWD and you have that VA exemption, you don't have to pay that extra 120 pesos. You only pay the base price of 1,000 pesos. It's like getting an instant discount just for being a PWD.
Okay, that makes it much clearer.
Yeah.
So in that scenario, the VAT exemption literally saves you 120 pesos. Not bad.
And remember, this applies to all the healthcare goods and services covered by the administrative order, not just medicines. So if you're buying an assistive device or if you have a hospital bill, the VAT exemption can really make a difference, especially for bigger expenses.
That's like the savings multiply as the cost goes up. So if I'm understanding this correctly, the 20% PWD discount is applied first to the price of the goods or services. And then the VAT exemption is calculated based on that discounted price.
You've got it. It's like a double dose of relief for your wallet. Let's say your hospital bill comes to 10,000 pesos. With the 20% PWD discount, that's immediately reduced to 8,000 pesos. Then they apply the 12% VAT exemption to that 8,000 pesos, saving you an additional 960 pesos. That's almost 1,000 pesos back in your pocket.
Wow, that's a significant chunk of change.
Yeah.
It's really incredible how this administrative order combines those two benefits, the discount and the VAT exemption, to really maximize affordability for PWDs.
It's all about recognizing the unique challenges PWDs face and making sure the system is there to support them. Now, one of the things that really struck me about this administrative order is its emphasis on transparency.
Yeah.
Or not just for PWDs, but for the establishments providing the goods and services as well.
Right. We talked about how hospitals have to post their room rates and make price lists available. That's a big deal for anyone trying to navigate the healthcare system, especially if you're dealing with unexpected expenses.
Exactly. It removes that element of surprise and allows PWDs to budget accordingly and make informed decisions about their care. And it also helps prevent establishments from trying to take advantage of people who might not be aware of all the details of the administrative order.
It's like a built-in safeguard against any shady practices. Everyone knows the rules of the game up front. But what about those situations where things don't go according to plan? What if a PWD encounters an establishment that's not following the guidelines, or they feel like their rights are being violated? What recourse do they have?
That's where the complaint mechanism comes in, right? We talked about this earlier. PWDs can report any issues to the National Council on Disability Affairs or their local government's Persons with Disability Affairs office.
Right, but what does that actually look like? Is it a complicated process?
Not really. It's designed to be pretty straightforward. The administrative order lays out clear procedures for filing a complaint. You can do it in person, by mail, or even electronically, and they have to take those complaints seriously. They're obligated to investigate any reported violations and take appropriate action.
So there's an actual system in place to hold establishments accountable.
Yes.
It's not just a matter of hoping they'll do the right thing. There are actual consequences if they don't comply with the guidelines.
Exactly. It's about empowering PWDs to advocate for their rights and ensuring that the system works as intended. And it's not just about reacting to problems. The administrative order also emphasizes proactive measures to ensure compliance.
Like those requirements for establishments to keep detailed records.
Right.
Of all transactions involving PWDs, that seems like a smart way to prevent any funny business from happening in the first place.
It's all about transparency and creating a clear paper trail. And remember how we talked about limits on over-the-counter medications?
Yeah.
That's another safeguard built into the system. Drugstores can limit the dispensing of over-the-counter drugs to a week's supply.
Okay.
For PWDs using the discount.
Right, so it's not a free-for-all. There are checks and balances to prevent any misuse of the benefits.
Exactly.
It's about finding that sweet spot between accessibility and responsibility.
Exactly. And it's not just about the establishments and the regulations themselves. Healthcare professionals play a crucial role in all of this, too.
Right.
They're often the ones who are guiding PWDs through the process and helping them access the benefits they're entitled to.
Yeah, that's a great point. They're kind of the gatekeepers in a lot of ways. So it's not just about handing out prescriptions. They need to be aware of these guidelines and be proactive in supporting their patients' rights.
Absolutely. They're encouraged to inform their PWD patients about the available benefits and to clearly explain the procedures for accessing them. It's about fostering a collaborative relationship where the healthcare professional is an advocate for the PWD, not a barrier.
It's a partnership.
Yeah.
And that makes perfect sense. They're the ones who understand the patient's needs and can help them navigate the system effectively. But they also have a responsibility to make sure the prescriptions they're writing are legitimate and intended solely for the use of the PWD.
Mm-hmm.
That's part of maintaining the integrity of the whole system.
Exactly. It's about ensuring the resources are going to those who need them most.
This deep dive has been incredibly eye-opening. I think we've really unpacked the nuances of this administrative order and explored its impact on healthcare accessibility for PWDs in the Philippines.
It's encouraging to see the progress being made towards a more inclusive and equitable healthcare system.
Absolutely. It's clear that a lot of thought and care went into crafting these guidelines. But as with any system, there's always room for improvement, right?
Right, and that's where ongoing dialogue and advocacy come in. It's crucial to keep the conversation going, to identify any challenges that arise, and to work together to find solutions that benefit everyone.
So for you, the listener, this isn't just about understanding a bunch of rules and regulations.
Right.
It's about knowing your rights, understanding the resources that are available to you, and feeling empowered to advocate for yourself or your loved ones.
Exactly. Knowledge is power. The more you understand about these guidelines, the better equipped you'll be to navigate the healthcare system and ensure that you're receiving the support you deserve.
And remember, this deep dive is just a starting point. Keep exploring this topic, keep asking questions, and keep pushing for progress. It's through continued dialogue, collaboration, and action that we can create a world where everyone has the opportunity to live a healthy and fulfilling life. Thanks for joining us on this journey.